The human respiratory system is a complex network that enables the inhalation of oxygen and the exhalation of carbon dioxide, a critical process for maintaining life. Its main organs include the nose, pharynx, larynx, trachea, bronchi, and lungs. The system functions through a series of steps, starting with the inhalation of air through the nose or mouth. The air then travels down the trachea, branching into the bronchi that lead into the lungs. Within the lungs, the bronchi further branch into smaller tubes called bronchioles, which culminate in clusters of tiny air sacs known as alveoli. The alveoli are the critical sites for gas exchange. They are surrounded by a network of capillaries through which oxygen diffuses into the blood, and carbon dioxide, a waste product of cellular metabolism, diffuses out to be exhaled. Oxygen-rich blood circulates throughout the body, fueling cellular processes, while the expulsion of carbon dioxide helps regulate the body's pH levels. The process of breathing is controlled by the respiratory center in the brainstem, which sends signals to the diaphragm and muscles surrounding the rib cage, instructing them to contract and relax, a mechanism called ventilation. The average adult human takes about 12 to 20 breaths per minute at rest. 1. Air quality. Exposure to pollutants, such as cigarette smoke, industrial emissions, and vehicle exhaust, can result in respiratory diseases like chronic obstructive pulmonary disease, COPD, and asthma. According to the World Health Organization, around 91% of the world's population lives in places where air quality exceeds WHO guideline limits. 2. Lifestyle choices. Smoking is a primary cause of lung cancer and COPD. Data from the Centers for Disease Control and Prevention, CDC, indicate that cigarette smoking accounts for about 1/5 of all deaths in the United States, many of these due to its impact on pulmonary health. 3. Occupational hazards. Jobs that expose individuals to dust, chemicals, or fumes can increase the risk of respiratory conditions. Regular and adequate personal protective equipment, PPE, use is essential in preventing occupational lung diseases. 4. Infectious diseases. Infections like pneumonia, tuberculosis, and the coronavirus disease, COVID-19, can severely compromise lung function. As per global health estimates, tuberculosis affects about a quarter of the world's population, severely impacting lung health with significant mortality and morbidity. 5. Chronic conditions. Diseases such as asthma or COPD can lead to long-term inflammation and scarring in the lungs, reducing their capacity over time. 6. Age. As people age, lung capacity naturally decreases. The muscles that aid breathing weaken, and the immune system might not respond as effectively, making elderly individuals more susceptible to respiratory infections and conditions. 7. Genetics. Genetic makeup can play a role in the susceptibility to and severity of various lung conditions, such as cystic fibrosis, alpha-1 antitrypsin deficiency, and certain forms of lung cancer. It's crucial to maintain lung health through lifestyle choices like not smoking, exercising regularly to improve respiratory muscle strength, eating a balanced diet rich in antioxidants, and avoiding exposure to lung irritants. Additionally, preventive actions such as vaccinations and regular health screenings can aid in the early detection and management of respiratory diseases. In conclusion, the respiratory system's pivotal role in sustaining life is influenced by a range of external and internal factors. Understanding and mitigating risks associated with poor lung health are integral to maintaining the overall well-being of the human respiratory system.